Many people will also present in my office with what's called a pelvic injury. They didn't just hit the cranium, sometimes they also hit the pelvis at the same time, or sometimes independently. They just fell on the ice on their bum. And what shows up is that there's particular files or programs that control how the pelvis moves, the pelvis musculature in particular, like a robot. We first activate the gluteus muscle, then we activate the quadratus lumborum, then we activate another muscle so it individually moves like independently. We just put it together and call it walking and running. But there's a sophisticated program to this, and if this becomes neurologically disorganized, the firing pattern is off. Like in a car, you'll hear it stuttering. Well, these people will notice now, no matter what they do, they exercise, they walk, they stretch, it always seems that their pelvis is tight or is stiff afterwards. Well, this is the body's way of saying, I'm in neural disorganization, it needs attention. However, they don't know this, so they just notice a stiffness and believe I worked out too hard the day before, or maybe I need to do more yoga or more stretching. But I've worked on people who have done stretching and yoga and all kinds of things, and they should be very good athletes, but they seem to always be tight and stiff. And what we found is by releasing the cranial systems and the pelvic systems in relationship to each other, you will release this pelvic patterning. Almost any condition that has hip degeneration, people who have even had a hip replacement, they say, well, you can't help me now. Yes, I can, because probably they had the pelvic injury complex. The circuitry was disorganized, which was what led to them having a struggle for 40 years, which led to the grinding down of the hip joint, and therefore the medics did replace the hip. However, the neurological pattern is still misfiring, so their rehabilitation time is taking a long time. Or they'll come to me and say, that hip's my bad hip, it'll never work again because I had it replaced. And all of a sudden, in 5 minutes, we turn on these circuits and they can hold their leg back up and they feel power again. So you're not going to know until you try. But this is one of the complexes that is quite commonly found in people, as well as a trauma to the coccyx, which can easily be released. But the order we do this in is first you must dissolve or disarm the cranium. This is the neurological priority. Then the jaw can be released. Once you've released the jaw, then you can release the pelvis, not the other way around.